This is a video on reproductive toxicology. In this video we'll be focusing on reproductive toxicology in the female reproductive system, focusing on two main toxins. We're a third year group studying pharmacology in UCD Dublin. We've developed some different resources to teach reproductive toxicology. You can follow these links to get those resources. For an overview of the reproductive system, please click here. In this video we'll be focusing on two different toxins of the female reproductive system. Many complexes induce side effects at sexually mature and pre-sexually mature ages. Female reproductive toxicity can be identified by many different factors. It can affect the reproductive organs, and it can also modify endocrine-mediated aspects of reproduction. The toxic response of the endocrine portion of the reproductive system generally relate to issues involving gametogenesis and fertility. It also involves steroidogenesis. The first toxin we'll be focusing on is diethylstilbesterol. Diethylstilbesterol is a synthetic estrogen. It was produced in the late 1930s. Exposure to diethylstilbesterol occurred mainly through food products, as it was being fed into cattle feed, and it is also exposed to people as a cancer chemotherapy. The original use of the drug was to reduce risks associated with pregnancy and also to reduce the risk of fetal abortion. Female fetuses that were exposed in utero to diethylstilbesterol developed reproductive toxicity. The drug is believed to be the first transplacental carcinogen. Pre-sexual maturation, it affects the development of the reproductive system. It also causes vaginal adenocarcinomas in later stages of life. It's believed that the possibility of a woman developing a vaginal adenocarcinoma is increased 40-fold if she's been exposed in utero to DES. The second toxin that we'll be focusing on is cyclophosphamide. As a toxin, it is responsible for ovarian failure. By doing so, it depletes oocyte formation. Cyclophosphamide is a xenobiotic. A xenobiotic is a chemical found in organisms that is not normally produced or expected to be present, i.e. it's exogenous. Cyclophosphamide is an alkylating agent used to treat cancer and autoimmune disorders such as lupus or severe rheumatoid arthritis. Alkylating agents effectively cross-link the DNA of rapidly dividing cells, causing apoptosis. Cyclophosphamide induces early onset menopause and can cause infertility.